Let's follow the journey of a blood donation. Getting this life-saving resource to local patients all starts with recruiting blood donors, whether that's by a blood drive coordinator, volunteer, donor recruiter, or a donable agent. We are all a vital piece of the puzzle to make sure there's enough blood for every patient who needs it. So, a blood donor says yes to donating. Donors can give blood at a mobile blood drive or at a donation center. Donors go into the screening room and answer a general health questionnaire. Then there's a mini physical. The phlebotomist checks the donor's temperature, pulse, blood pressure, and iron level. Once they're clear to donate, they make their donation. The average donation takes 7 to 10 minutes. Front to back, the whole donation process is about an hour. Once a donation is complete, it moves to processing. The blood donation is tested to make sure it's safe for the patient and then processed to be ready for a transfusion. This can take up to 48 hours. Now the donation is ready to move on. Every day, hospital orders come into OBI. There are regular standing orders for things the hospital has planned for, and also orders that come in suddenly for emergencies. It's a reminder of why it's so important to have enough blood on hand to send. Sometimes OBI is on call to help other blood centers in other parts of the country when a tragedy happens in their community too. Once the orders are ready, a dedicated team picks up the blood and takes it to the hospital. The donations are hand-delivered to the staff at the hospital waiting for the blood. Deliveries happen every day around the clock. Now that the blood is at the hospital, it can be used to save lives. There are all sorts of patients who need blood every day. Patients like Addison, who needed blood transfusion throughout her cancer treatment.
Once she gets the blood, it completely changes the way she feels. She doesn't pass out. It's not medically scary anymore. Her blood pressure goes back to normal.
And I feel like I can play and color and
Be a kid.
Be a kid.
Yeah, be a kid.
Then once I start getting blood after like half of it's gone, I feel good. Like rainbows.
Like rainbows and sprinkles, that's her normal.
Sprinkles and sparkles and unicorns and all of the pretty stuff.
There are so many people involved in making sure blood gets to patients safely and quickly. Every step gets us one step closer to saving lives.